Hi, we are breast friends. We're here for you so that you are not alone in this journey. Oftentimes, we saw that runners running for breast cancer or having great hackathons like this to really showcase that we care about patients. And oftentimes, we thought about patients will have their friends and their family along with them, so they're actually not quite alone. Given the growing amount of cases, we thought patients always have the support they want. But the truth is, they're so alone in their journey. My friend's mom, she told us that she felt the pain so hard when she wasn't given the information by the caregiver about the drug she's taking, while she can definitely avoid that if someone told her ahead of time. When she was in the chemotherapy room, she felt so alone because none of her family members can actually go into the room and be there for her. We are best friends. Let's walk this journey together.
So our user journey is comprised of 4 simple steps. Whenever they log on, it will collect the patient profile and medical history. Step 2, whenever doctors supply their treatment plans, we have advanced AI that will predict the patient's symptom timeline and critical milestones in their treatment plans. Step 3, the AI will crunch the numbers, do similarity metrics, and recommend tasks that family members and friends can then subscribe to in step 4 to organize support for the patient and maximize patient care and outcomes.
So here is how it works. We plan to build an entry-level system, more like a dispatcher that attempts to understand how and in which ways we can help the patient. We plan to collect data first by reading the patient profile, a description regarding their conditions, symptoms, financial and relationship status, and more. And then we feed this to an AI engine that basically is supposed to crunch the data, to analyze the data from the user, from the other users, and perhaps additional data, and then suggest some tasks to help the patient's journey. Some possible tasks are listed here. For example, cooking food to comfort the patient, hanging out with them, walking their dogs, providing financial aid, food delivery, and giving them rides, and so on.
Here are the competitive advantages and the impact we want to make on the society and the most important, patient themselves. We want to help predict patient journey so that they can avoid as much as playing or just having the family and members there to support them. Second is to really reduce the stress they're going through. Knowing that someone has breast cancer is already such a big news to the family, and we want to help lift that burden in any ways we could. Last but not least, build a strong community that emphasize the social aspects and really help enhance the life quality of breast cancer patients. There are major competitors out there, but we believe that our apps truly provide and predict the patient journey to help support the patient, her or himself, and their families and friends so that they can recover as soon as they could. And remember that this journey, they're not walking alone. Thinking of the future, this is a map of 2025. We know that currently there are still rising amount of cases everywhere around the globe. And we know that no matter where you are, knowing that someone out there is going through the same thing, and this is also one of our vision, is to grow and help as many patients as possible and really personalize the patient journey in any way we can. We are your best friend and we care.